Thank you, everyone. It is just terrific, good to be together. This is a program I've been wanting to do for a long time, and I'm appreciative of the fact that you've joined us and that we're gathering with three really phenomenal professionals. And so I'm grateful to Alicia and Lisa and Jenny for being gracious with their time. This is what your work is, but gracious in your time and planning this and being here together. We're having this conversation today because it just seemed like it was an important one to have, to open doors, to share information, and to help parents. I think we even have a couple of grandparents on this call, to have more information to figure out where to go and who to talk to and how to identify things that you may say like, yes, this is typical. No, this is typical. I'm not sure. In my experience professionally and to some extent personally, I've seen that like even the most knowledgeable and sophisticated of us don't always know where to start conversation. So my hope is that today that I know that we'll hear from our professionals. We've got an outline of a conversation. We'll open to Q&A at the end. And if you have questions as you go through, you can put them in the chat. But my goal is to open the door to have more knowledge so that those of us who are wrestling with stuff or aren't sure have beginning tools and paths to where we can go. After this session is being recorded. We will record through all of it, but before we share it in any public sphere, we will cut off the questions. So it will just be the presenters speaking. So I want everyone to feel comfortable in this space. After the session is done, we will share the video with all of you, and I will share contact information for our professionals should you want to reach out to them in professional capacity and resources there. So I'm really thrilled today to gather with three people I have utmost respect. First, I will invite and introduce Jenny Welbel. Jenny has her BA in psychology from University of Michigan, and her MA in counseling psychology from Northwestern. She's got a wealth of experience with working on anxiety and OCD. She worked for many years at Compass and right now is in private practice and has many other phenomenal pieces on her resume. I'm giving very short descriptions, not to do a disservice to Jenny or anyone else, but I want to get to the topic of it. And so thank you, Jenny. And Jenny and I have been talking about doing this program for several years. Lisa Ehrlich is the manager of community education at Response for Teens. If you don't know about Response, well, then you will as of today. Response is an amazing program, independent but connected through JCFS. And before joining Response, Lisa honed her experience in curriculum design and social and emotional learning as a teacher in the Chicago public schools. I think that gets you a medal. And she's worked with young people in schools and camps and youth organizations, elevating youth voices, helping teens navigate their own intersectional identity. And Lisa, welcome back. We've done some programming as well on gender and sexual identity with our teens and with parents a few years ago. I think some of these parents may have actually been on that. And Alicia Guy. Alicia has a BA in Communications Studies and Social Welfare from Marquette, and she has a Master of Social Work from Loyola in Chicago as a licensed clinical social worker. She has tremendous experience. She was an intern at Glenbrook North. She's now a school social worker at New Trier High School, and also was a private practice therapist, and can see patients and parents who are not New Trier students, right? Did I get that right? And she brings an incredible amount of experience working with students, working with teens, working to counsel students with substance abuse, eating disorders, and addiction, among other things. So I'm really, really grateful, Lisa, Jenny, and Alicia, for joining us. And for the first time of all of us working together. Some of you have worked together and in the past. So we're going to start out we're going to start out with Lisa to talk a little bit about what anxiety looks like in kids. What is developmentally typical? What can we expect? And when does it become problematic? And we'll go from there. And I invite people to stay muted. Please, if you have questions, put them in the chat and I'll do my best to keep up with them. We'll get to as many as we can. Lisa.
All right, thank you. I am really happy, and I don't know, a little odd to be on a panel of professionals about this. I think that my expertise area is really in adolescence. So really thinking about fifth on up, um, fifth grade on up. We can talk a little bit about what it looks like in younger kids, but that's not really where I focus. So I want to make sure that I'm clear about that. Um, I think in the 10 minutes that, really thinking about to wrap it up so that everybody can talk, what's really important is kind of where we see anxiety present like across adolescence in different areas and how that looks different from adolescence. Because we as adults, we tend to do this wonderful thing where we forget the pain of adolescence and the struggle of adolescence and what it was like to be an adolescent. And we look at our kids sometimes and are like, why are they being so dramatic? Like, what is the big deal? What's going, like, we forget how to put ourselves in those shoes. And then also, we need to remember that the world is a very different place than when all of us were young. And so they actually have a lot more factors that lead to feeling anxious, right? I'm going to talk about feeling anxious rather than anxiety when I talk about like kind of typical adolescence and norms. One of the things to think about is where their brains are at and what their brains are supposed to be doing, right? So their brains are in a space where they are supposed to be doing a couple different things. One is risk taking, right? And with risk taking, that can mean anything for your child. And that can be something as small as calling a friend or telling a friend that what that friend did hurt their feelings. So, for example, and I will apologize, I will use my examples of high school students that I've worked with, and my own children are adolescents. They are in fifth and seventh grade. And so, a lot of times I use my own children as examples, but that is a huge risk for my seventh grader. Actually calling up, because what happens is right now with their brain, they are so afraid of peer judgment. Peer approval is the reward center of their brain right now. So the bigger risk is to lose that peer approval. And they really do think about it. And for us, our brains are different. And so losing peer approval is not as important to us anymore. And a lot of times we talk about, well, why can't you just, it doesn't matter what they say. But the problem is that it does physically matter to their brains. And that's something that we have to reorient because their brains are developing like this so that they can grow legs, so that they can kind of really push out on their own. But what that means is that they need support and ways of thinking about how to work through it. So that could look anxious, right? That cause feelings of anxiety. The other thing to think about is the impact of the internet on their brains. So the one thing I'm going to say really quickly, when we talk, you might see the internet flooded with happy chemicals, how to hack your happy chemicals. One thing, how do we take the phones away from our kids, especially with COVID, when so many of them were dependent on them for so long? One of the ways that we are seeing an increase in anxiety is because of the constant time on the phones. And it's difficult. Our brains literally are wired to compare ourselves to people, like to our communities. The problem is that when we are on a screen constantly and we are now connected to millions of people, that is no longer our community, right? That's not what our brains were wired for. And so instead, 24 hours a day, our brains are overloaded with these comparisons. And what happens is that balance of chemicals, right? We get cortisol, it raises our anxiety. That then, the calming things that we do, like petting our dogs, it doesn't counteract it, right? And so our kids are finding that they are online so often that they are not finding ways of shutting down the comparisons. And when you think about where their brain is with peer comparison, it's really hard. So that was kind of like the scary news. Here is some of the good news. The majority of teens will have these feelings of anxiety and build resilience with support and manage through adolescence. Okay, I'm not going to say like amazingly, because we are all adults who have managed through our adolescence and are possibly now realizing that therapy is a good thing, right? So like we all need things, but most teens will, this is what we all go through as adults. Where you will find when it starts to be a problem, right? So you might get anger from your teen. It might look like anger. It might look like withdrawal. It might look a huge thing like indecisiveness, right? Not being able to make choices because they are so worried about what they want to do internally and what it will look like externally or who they might be disappointing, right? That's typical. That is really typical and a part of adolescence. Struggling to make decisions, fighting against parents, feeling anxious about how they're going to be judged. It doesn't make it good, but it is typical, right? That is especially sixth, seventh, and eighth grade are the hardest times for adolescents because their brains and their bodies are growing at the same time and it is messy. When it stops being typical, when I do like mental health first aid trainings, the thing that we talk about the most is when your child is unable to live, laugh, love, when they are unable to function, when they are calling you to be picked up from school because they can't be in the place because their anxiety is paralyzing them, right? When they break down every time a decision needs to be made, right? So what you want to think about is we think about like occurrence and depth, right? So like really getting upset about decisions and feeling uncomfortable is one thing. Becoming not being able to make it through a decision despite the discomfort is something else, right? Um, when we think about how often it's happening, right? Kids need mental health days. We all do. Needing one more often than not when you're finding that it's happening once a week, multiple times a week, right? When it is impacting, when they stop doing activities and don't replace them with something else, right? So now's a time where you might get nervous if your child stops hanging out with certain friends, but they're figuring out who they are, right? And so they might not have the same friends, but if they are not finding other spaces, other social spaces, then it's time to pay attention, right? So a lot of times what I talk about, I don't say it's time to worry, I say it's time to pay attention, right? And how to open the door with your young person about what's going on. And instead of doing what so many parents do, me included, instead of going 10 years down the road in 5 seconds and panicking that like this is going to ruin my kid's life, they're going to be miserable, it's going to be horrible, like, right, catastrophic, we go into like these catastrophic thinking things because we care about our children. Trying to breathe and realizing that we need to come with curiosity and see if we can ask the young person what's going on. And in adolescence you might get a nothing, and that's okay, right? And then you kind of keep opening the door at different points. But when you're noticing that it is a pattern that's happening and it's happening more often and it's stopping their ability to function in spaces that they used to be able to function, that's when it's really time to pay attention. And that's when I would say that this is where Alicia and Jennifer come in, right? That's when it is beyond someone like me who works in youth empowerment and youth engagement programming and can talk with kids through feeling anxious. When it's impacting their ability to function, that's when it gets into needing someone who has their degree in this, needing someone who specializes in when it is more than having a supportive adult who knows about social emotional like education. I want to make sure that I don't talk for too long. So the other thing that I want to say very specifically about COVID. So COVID has increased anxiety, period. Our kids, especially young kids and adolescents, feed off of their adults' anxiety as well. So they are feeling their own anxiety and they are feeding off of ours, right? The fact that some of their friends may not have the same risk tolerance, right? Or mask policies or vaccine situations as their friends, that is going to cause them to feel anxious, right? Because they have never had to deal with that before. As adults, we haven't been in this situation before, right? And so one of the things that I will tell you is being vulnerable and opening your kids, your adolescents to vulnerability and saying, I'm not sure. This is really tough, right? And realizing that we are not necessarily the adults who have to have all the answers. But what COVID has also done is it has brought to light our young people's mental health struggles. And what so many young people have voiced to me and to other people in professions like mine is that they are really worried that when things get quote unquote back to normal, that their mental health will be pushed to the side again. That what we are seeing is exacerbated by COVID, but that the need to address anxiety and mental health in our young people was around before COVID. It was just exacerbated, and a lot of people wrote it off as just being a teenager. And so what I will implore to you is that I think it is amazing that you are all here, because this is the first step in really thinking about how to support your young person. With that, I think I want to make sure that I don't talk for too long.
Great. Thanks, Lisa. Really just perfect. And we turn to Jenny to talk about what parents can do to support their kids in the moment of struggle and in the broader sense too. Jenny?
Great, thank you. So let me start by saying that as parents, we hate seeing our kids in pain, right? Parent myself, similar to Lisa, right? And whether it's emotional or physical pain. And the problem is that it is impossible and counterproductive to shield and protect your child from every anxiety-provoking and distressing situation. So as parents, the best thing you can really learn to do is to help your child confront their fears and their worries. And by doing this, they build confidence in their ability to cope with distressing situations, right? So easier said than done, right? And so what does it look like, right? So one way I really like to think about this is my colleague, a friend and colleague, Dr. Caroline Edelman, she's actually Chicago-based, came up with this analogy where she compared parenting an anxious child to a lot like teaching a child to ride a bike, right? And so I think all of us here have either learned to ride a bike, taught our children, our loved ones, our partners to ride bikes, right? Typically what happens in riding a bike, you get on the bike, you fall off the bike, right? You might have a skinned knee. When our kids do that, we go up to them, we validate, wow, like that looks like that really hurts, right? Are you okay? Once we see that they're fine, we say, all right, when you're ready, let's get back on your bike and let's do it again, right? We typically don't say, you know what, you fell once, you never have to learn to ride your bike again. Conversely, we don't say, you know what, I'll ride your bike for you for the rest of your life, right? We don't do that, right? And so when we're parenting an anxious child, we want to do the same thing. We want to validate how our kids are feeling, right? We don't want to dismiss whatever their emotion is. And we want to show confidence that they can cope, right? Like, I know you can get back on your bike, right? So to put it in probably a more maybe developmentally appropriate example, right? I think Lisa had mentioned like kids that don't want to go to school, right? So let's say you've got a kid who calls you up from school and they're like, I want to go home. I really want to go home. As a parent, your heart is breaking. You're like, what do I do? Right? The first thing you do is you validate them and you say, I know this is really hard. I know you're really scared or nervous or whatever the emotion is that they're feeling. And you say, I know you can get through the day. Right? Now they may say, what? How am I supposed to do that? I can't do that. You might hear the kind of spiral, right? And this is when we put it back onto them and say, what are the things that you think you can do to help you get through today, this moment, this hour, right? We don't want to solve it for them. And we want to help them come up with tools that help them stay in the scary situation, not avoid, which in this case is school, right? And look, there's so many tools that can be used with your kids. So I'm going to give you like a couple really quickly. You can help your kids, helping them do some deep breathing, some diaphragmatic breathing. You can help them challenge some of the thoughts that they might have. You can also encourage them in that moment to reach out to a social worker like Alicia, right? So there's a lot of different things, but the idea is you want to encourage them to stay. And by doing that, you're saying, I know this is scary and I know you can do it. And you're helping them build that confidence. A couple other ways to support our anxious kids, like I said, is helping them lean into and confront anxiety-provoking situations, whatever it is. I know anxious individuals are naturally gonna want to avoid things that make them anxious, right? And when we avoid in the short term, it feels great, right? We're scared of doing something, we don't do it, we feel amazing, right? But long term, it perpetuates that anxiety. So we want to help our kids gradually confront the things that they're most fearful of. We also, and Lisa touched on this a little bit, but we want to acknowledge moments when we're stressed, right? And we want to kind of model effective coping. Anxiety is a natural, normal emotion. And the best gift you can give your kids is to teach them to not be fearful of it, right? Because as parents, if we're anxious about our own anxiety, right? Well, to Lisa's point, they're going to pick up on that, right? Another really important way, and I could talk about this for hours, so I'm really kind of just hitting the nuggets here, that we can support our anxious kids is to decrease accommodations of our child's anxiety, right? And one way that I coach parents a lot about is decreasing reassurance, right? So again, it is totally normal for children to look to their parents to provide them with information about the world, and for parents to provide kids with information about challenging situations. Absolutely helpful, normal, typical. But for some kids, asking reassurance about the same situation over and over and over again becomes an unhelpful way of coping. This is often referred to as excessive reassurance seeking, right? And it looks different depending on the kids, right? If you've got a kid who's generalized anxiety kid, worried about a lot of different things, I think of this as like the what if-er, what if this, what if this, what if this, right? They might be saying, are you sure you locked all the doors? Promise me you locked all the doors, right? Your child might struggle with separation anxiety and be constantly asking you like, promise me you'll pick me up, promise me you'll pick me up. You know what time school ends, right? Promise me you'll pick me up, right? You might have the perfectionist high school kid who keeps asking you to go over their homework time and time again to make sure there aren't any mistakes. The problem with reassurance, because a lot of parents will say, well, what's wrong with this, right? My kid is anxious. I'm helping them feel better. Like, what's the problem, right? And the problem is that reassurance it's addictive. It's a vicious cycle. The more you give it, the more you want it, right? Or the more you get it, the more you want it. And you may have seen with some of your kids that as you have kind of given in to this reassurance, it has kind of increased exponentially, right? And that's because when we give our kids excessive reassurance, we're decreasing their confidence and diminishing their own confidence in their ability to cope and to answer their own questions, right? And again, we're lessening their anxiety in the short term, but perpetuating it in the long term. And one thing I should quickly note about this is there's a difference between information seeking and reassurance seeking, right? So if we think about COVID, right, and you have a kid who doesn't know a lot about COVID or how it transmits, and they're really asking you like, hey, if I touch this doorknob, am I going to get COVID? Do I need to wash my hands? And you as a parent explain, you know what, that's actually not how it's transmitted. We thought it was, whatever the science behind it. You don't need to wash your hands. You say that once, that's information you're giving them. Now your kid comes home and continually asks you, do I need to wash my hands? Do I need to do this? You've already answered that, right? So that's just a simplified version to help you kind of understand information seeking versus reassurance seeking. And so if your kid is doing a lot of reassurance seeking, the question is, well, great, what do we do, right? How do we decrease that? And I always say, like, the most important thing is you want to create a really clear plan with your kids. This is not about surprising them or just like, just kind of all of a sudden removing it all from them. It's creating a plan in which typically, and again, there's a lot of different ways to do this, we slowly pull back and decrease. You can decrease the number of questions you're asking, the types of questions you're answering, and you can give some common responses like, I don't know, what do you think? I always think, what do you think is a really great response because you're putting it back on your kid and you're not being invalidating because they know the plan. You're really saying, what do you think? You could say you already know the answer to that. I think the funny thing is that kids, it's important to have a plan because if you just say one of these, kids are inevitably going to get annoyed. Right. And I'm like, oh, why are you saying that? Right. But part of this is it's teaching them to answer these questions themselves. And so I think in reflecting on this, like I said, there's a lot of ways you guys can support your kids, and there's not one right way. There's not one magic wand or perfect way to do this. But the biggest thing I hope you take away is that in order to best support your child's anxiety, you have to stop protecting them and shielding them from feeling sadness or pain or experiencing anxiety, and instead help them kind of face their fears, lean into it, because by doing that, you're building resiliency, and building their confidence and their ability to cope.
Great. Thanks, Jenny. Do you want to turn also to the next topic of the health therapeutic support and opening the door to that?
So, and I'll segue to something Lisa said of like, okay, so then you turn to the professional, right? Like, what do we do? Who do we turn to? And I think there's a ton of supports, right? I always say, start with the schools, right? And I know Alicia is going to speak after I do, but they're a great place to start, and she can kind of talk about her role. From there, it's kind of the individual outpatient provider, a private practitioner. We typically do once a week, maybe twice a week therapy. In terms of what type of therapy, I'm biased. I practice cognitive behavioral therapy. I really believe in science and what's evidence-based. I think for anxiety, that really is the best type of therapy because you're looking at challenging your thoughts and behaviors, but there's a lot of different modalities, right? From there, let's say you've got a kid who's been in individual weekly therapy or biweekly therapy for a significant amount of time. And you're like, we're not seeing the changes we want to see. Now you have to be careful. Is it because sometimes parents expect, as a parent myself, we expect certain things. So I say, in collaboration with your outpatient provider, right? Sometimes kids need a little bit more. That's okay, right? There's nothing wrong with that. So sometimes we turn to intensive outpatient programs, which are typically, this may be, I'm just naming out programs, right? There's no good or bad. There's Rogers, there's Amita, there's Compass, there's North Shore, right? And these are programs that can do a couple hours a day, couple times a week, short period of time. The level up from there is if they need more, if they're not going to school, right? They are, their anxiety is impacting their life so much. They're feeling, suicidal or not getting out of bed. There are partial hospitalization programs, PHP. Don't let the hospital part scare you. There's not a better acronym, right? But we think of these as just higher levels of care. Typically, these are in office buildings, not hospitals. And I describe it to the kiddos I work with as like therapy boot camp. You're doing therapy like 5 to 6 hours a day, 5 days a week for a really, really short time, 2 to 4 weeks. Then you typically transition down to an intensive outpatient program. There are even higher levels of care than that I'm not going to, that I'm not even going to go into. But I think recognizing what I want you to recognize, there's a lot of different options and there's not a one size fits all. And sometimes you have to try a lot of different things to figure out what works for your kid. And you might have to try different programs and or different therapists. So keeping that in mind.
Can I jump in a second, Jenny? I'm not a professional. I don't play one on TV, but I will say, I want to step back to, for parents who are not even sure where to start, right? Grandparents are not even sure where to start. Like you said it, and Alicia, you'll address it, start at school, right? School social worker, school psychologist, have a conversation, let them, check in with your child, check in with you. You can start with a pediatrician to just sort of start a conversation. We rabbis in Canada, some are trained, and NSCI, we're not trained, we're not doing therapy, but, we have some names for referrals. We can give you names to sort of start, and if you've been in therapy yourself or your family members have, that it's a relationship, right? So the first therapist you work with may not be the one you stay with, right? And because often people are like, oh, I started and it didn't work, or it wasn't the right person for my kid. You kind of have to start, way back in the dark ages when I was in rabbinical school, we were told to always give 3 names. I don't know if that's still the thing, but I still do,
No, I think, I tell people all the time, I think finding the right therapist is a lot like dating, right? You got to try a lot of different people, and what works for one may not work for the other. And to not get turned off by that, to not get discouraged by that, I think is also really important.
Yeah. And to know that your best friend may love someone and you may have a conversation on the phone and be like, oh God, no, can't even imagine that, or vice versa, and so to kind of, there are lots of resources out there to start. Jenny, do you want to say more? Or I turn to Alicia?
No, I think that's great. I think Alicia.
So Alicia, do you want to talk about where we are in the schools and
sure.
those connections?
Yes. And just to piggyback off of what Jenny said, with therapy, it's time, it's money, it's an emotional investment. And so really it's about finding that good fit. And so again, we also give several names when we give referrals. Don't get discouraged. And sometimes even in schools, it's like that. Maybe your child meets with somebody in crisis and they don't necessarily click, but they could get assigned a different social worker. So I'm just going to kind of start off and say that I facilitate a school social work consortium where we meet quarterly, and it is social workers all the way west of Barrington, as far north as Lake Forest. And the most common thing every single school has seen is increase in anxiety, also increase in behaviors from children that never showed and displayed behaviors before. Maybe they're more combative, they're more irritable. That might be at school, that might be at home. But we've definitely seen the increase in that and the change since COVID. I would say that one thing, if your child comes to you and says, I want to see a therapist, listen to them. Likely, and I will say this out of my private clients and out of my students at school, likely they've been feeling that way for a while. And when they come to you, a lot of times I hear, well, I've been feeling this way for a year and no one noticed and I didn't say anything. And now I really want therapy. And sometimes parents are like, whoa, this is out of the blue. Why do you need therapy? I didn't know you were feeling this way for a long time. And so just really listen to them, or if they ask to see a social worker at school, it's okay. You know, we're kind of one of the first line people to get them that support. And so with schools, I would say start with at New Trier specifically, we have the advisor system. Start with the advisor. If your child has an IEP, I would contact the case manager, if they have a assigned social worker. And if they're not, you know, assigned, or they don't have a good relationship with their advisor and they're not close, you can call the social work department. You can email any one of us, and we're happy to help you. I do parent consultation all the time. What's really helpful for us is if parents can describe the behavior that they're seeing and the observations. So if you call up and just say, my kid is anxious and I can't get them out the door to come to school. Okay, well, give us a little bit more. Like, were there any conversations the night before? Did something happen on social media? How long have you been seeing this avoidant behavior? What else is going on? And then we can come up with a plan of, okay, these are going to be the people they're going to check in with during the day. These are the skills that we're going to try. I'll advise students, like, if you're anxious in the hallways, let's make a plan and figure out which hallway is less crowded that you can go. Let's put in headphones. You can listen to a meditation app, to music on your way to class to really lessen that anxiety. And so, you know, we will work with them. We're very collaborative. It's a team approach. And we also sometimes give case managers or advisors some of these skills too, to reinforce for students when they show up first thing in the morning, so that they can have a pretty smooth day. The other thing that I wanted to say is, in schools, how we see this increased anxiety play out is, and it's been mentioned by Lisa and Jenny before, avoidance of coming to school, avoiding specific classes, avoiding or procrastinating homework and waiting till the last minute, increase in substance use to manage their mood. A lot of kids, the anxiety is too much, and so they need to medicate with whether it's marijuana or alcohol or pills, so that they have some relief. And really looking at that and the other signs and who they're hanging with. Tardiness to class. I see a lot of that. Kids want to avoid the hallways. It's a big school. It's crowded. It's like this at Highland Park, at Stevenson, at Deerfield. And again, it's working with your supports, getting strategies, whether it's outside therapist or school social worker, or both of us teaming, to make school a little bit more of a comfortable place. And like Lisa had said, really looking at what is the frequency of these anxiety, either, you know, if it's like a panic attack or a meltdown, or, you know, asking for reassurance, the depth and the duration. Like, is this once a month, once in a while thing? That's normal. That's normal adolescent anxiety. Okay, is this every day? Is this every time it's a gym class? Every day it's a test? Every Monday after a weekend? And really looking at, hey, here's what I observe. I observe that you isolate in your room after school. I see that you're not going out with friends as much. I'm getting emails from your teacher. What's going on? So really to point out to students, you know, or your own child, like, this is what I'm observing. That tells me that something is not okay. Let's talk about it. How can we work together? Again, as Jenny and Lisa said, validate their feelings, but also not enable. The more you pick your child up from school because they're crying in the bathroom, the harder it's going to be for them to walk into school the next day. And in those moments, as a parent, again, you don't want to see your child in distress. Encouraging them, who can you go to for support? I always ask students, who is a supportive adult in your life? Whether it's mom or dad, a coach, an advisor, go to them, check in, say you're having a hard day, take one class period at a time versus looking at the whole day, so that we can help them manage that anxiety and get through the day. And the more they can do it, the better confidence they build in themselves. And then, you know, things start to kind of work themselves through, and school doesn't have to be as scary of a place for them.
Great, thank you. Can I just name, I think sometimes for us as parents, we feel like there's a parental weakness, or we missed something or didn't do it, and we've missed something thus far. I mean, let's face it, as parents, we've all missed stuff. Like, let's just name it, we're human. But like, it's not a parent failing if our child is struggling. And just, again, like, we live in a society where it's like, okay, everyone has to be perfect at everything. And like, we have to acknowledge that, like, this is hard. And just like, right, if our kids had a fever, we would keep them home from school. Like, mental health, emotional health is not in the same par in our society. It's getting better in terms of acknowledging it. So even if it's something that's really unfamiliar to us, we have to acknowledge that, you know, we're supporting our kids, just like we take them to the pediatrician if they need stitches or whatever.
Mm-hmm. And I encourage kids. Oh, sorry, Lisa.
No, go ahead, because I want to say something before.
Yeah, no, I encourage and commend kids for when they walk into our office. That is not an easy thing for anybody to do. For a parent to pick up the phone and call resources, an outside therapist, the school, that's not always an easy thing, right? Because of that self-judgment. And please know we view that as a strength, and that we want to collaborate with you in teams so that we can support your child. And so please know that there's no judgment on our end. Sometimes we're also struggling with coming up with the proper intervention for a student, and just really getting on the same page and communicating progress and roadblocks is helpful.
Mm-hmm. Thanks, Lisa. Thanks.
Yeah, I just want to speak to two things that I heard that were that are really important too. So one, speaking as a parent, it's not also sometimes too that you miss things, but that you see what's going on and you feel like you can't do enough, or that you haven't done enough. And as a parent who is in that, who right now, I am right there with you. Finding ways to also take care of yourself while you are working to support your child is really important. Another thing to think about when we talk about some of the, especially what Jennifer mentioned about the higher, some like kids who are really high achieving, who parents will say they put this pressure on themselves, they're doing this. One thing that I have heard time and time again in programs that I've been doing, like mental health programs I've been doing with teens since the pandemic, is that a lot of the kids who would be able to go at this breakneck pace, and the ones who took classes during lunch, took 0 hour, they are not able to keep that pace up. And it was such a part of their identity that they are really struggling because they have never asked for help before. They have never had to. And so one of the things that we do that I will give, I will help, and I'll give to Rabbi Green to provide after. One of the things is like actually work one way when it's your kid is feeling anxious about this risk, is to do two things. And one is kind of a, what's the worst that's going to happen? Right? So you take them through this, what's the worst that's going to happen? And somebody just said for younger 4th and 5th graders, start now. What is the worst that's going to happen? And sometimes the worst that's going to happen, one, isn't that bad. And two, if it is like it is not going to be the worst that is going to happen, right? And so actually having them verbalize it and even writing it down to help them see and like get through it. And then the other one is something that if you ask your teacher, if you say to your teacher, I can't turn in this assignment because I needed to go to sleep, can I have an extension? If your teacher says no, what are you going to do? What's going to happen, right? Because this idea of a grade dropping is so terrifying for some of our students, and it's terrifying for us. I'm sorry, but the fact that we can see our kids' grades anytime we want means that we are looking more. And parents forget. As a teacher, I have to remind parents, stop looking. Stop looking every second. We panic about those fluctuations, but our kids need to start learning who to ask for help and how to ask for help, and what's the worst that happens if this person doesn't help them, like says no, right? So if we walk them through it and it feels awkward, in 4th and 5th grade, I do it with my 5th grader already, we're learning how to do it so she learns how to think and problem solve instead of assuming that she knows what the answer is going to be and not asking. So that's a big thing for me, that I do with my own children and that I always tell parents to do with their kids from 4th and 5th on up.
Thanks. I am really, really grateful for the generosity of time. Alicia, I think you're on your lunch break. Jenny, I think you're on your lunch break. And Lisa, I think we squished into your schedule. I'm really grateful to all three of you for for so graciously sharing your expertise and your time. And I'm grateful to all of you who took the time to be here today. And please share this, the recording as you get it with others. And if there's additional programming or conversation or bringing together, of experts to open the doors for you from within our NSCI community, I would be very happy to do that. So thank you all. Have a really great day. And I hope it gets warm. Thanks so much. Have a good one.